pleasure to let me talk to you guys, the medical staff, and I want to talk about lymphedema and lipedema, which are really poorly recognized and poorly known conditions. They're not that uncommon, but they're just poorly recognized. Next slide, please. So lipedema is a fat disease which is relatively resistant to weight loss and associated with disproportionate accumulation on the legs and arms, so the extremities of legs, and it has a high output lymphatic failure. And then lymphedema, next slide please. Lymphedema is a disruption of the lymphatic flow because of an obstruction or absence of lymphatic structures. So lipedema, it's estimated, though it's not exactly clear, that up to 11% of the female population has lipedema. Lymphedema is very prevalent worldwide, and it's actually much more prevalent here in the United States than it's walking among us. It's about 1 in 1,000 people in the U.S. Yeah. Next slide, please. So I want to spend a little time on the lymphatic system, and basically, so everybody knows the arterial venous circulation, which is a closed system, but lymphatics is a open system. So there's a transudate created at the capillary level that then is picked up by in the tissues, and then that's picked up by lymphatic capillaries, then through to lymphatic vessels and collecting ducts, and then filters into the lymph nodes, and then is returned back into the venous circulation. And so this is really, in a way, this is the septic system of the circulation, large molecules, cellular debris, but it's full of lymphs and immune proteins, and so it's really responsible for healing, remodeling, so many things that we take for granted occur through the lymphatic system, and this is just a diagram of those collecting systems in greater detail. Next slide, please. So lipedema can cause immobility, disability. It impairs the activities of daily living, climbing stairs, getting in and out of tubs, etc., out of chairs, and causes secondary lymphedema. And then orthopedic changes, including the hip, knees, ankles, and accelerated arthritis in those. And then I'm going to talk more about that, but lymphedema also causes a lot of things. In fact, it also causes limb enlargement and immobility and disability and infections. Obviously, any limb that has lymphedema in it is much higher risk for infections and even cancer in that. So it's in the area where there's a lymphatic injury or lymphatic insufficiency, there is relative immune compromise. So it's kind of, it shows you how our immune system we think of as a total, but is really segmented throughout our body. Next slide. So this is a picture of lipedema, and this is like the cuffs are the classic signs. You see columning over the knees, and this is this disproportionate, so out of proportion to the rest of the fat. This is abundant subcutaneous adipose tissue with fibrosis in it, and that's what lipedema looks like. And so these are the classic signs. They maybe have this has lobules over the hips and lobules at the knee, and it doesn't, you don't have to be a doctor to realize that this is going to impair mobility. Next slide, please. So this is lymphedema, and I just snapped this picture in my office, and so you can see there's some similarities. You see some lobules and cuffs, but the foot is involved, whereas in the other one, I guess we could go back, but I mean, or you could take my word that the foot is spared in lipedema. And that's one of the things, and one of the ways we diagnose lipedema versus lymphedema is the stemmer sign, where you pinch the skin. So this would have a positive stemmer sign, and would be lymphedema. And here's a earlier stage of just a little mild lymphedema just in this right leg, and the left leg is unemphytic. So you can see the vessels and the markings on the normal leg, and then here there's some swelling, and the tissue is firm and soft. I don't think you guys at least can appreciate it from this picture, but there's actually a little bit of redness. And a lot of times people with lymphedema have a reddened thing, and they're confused with being infected. But she doesn't have an active infection, though there are increased risk for infection. There's a lymphatic rubra, or just a redness to the skin because of lymphatic congestion. So it's something that's really helpful, because if you're having, someone, this comes up, they might get admitted for cellulitis, and they don't really have cellulitis, or they might get, there might be, or there might be a concern about infection, and it's just lymphedema. Or if they do get an infection, it spreads rapidly, and they get lymphangitis up the leg like wildfire. So, okay, next slide, please. So again, the cuffs and lobules, and the negative stemmer sign, the lipedema, and the progressive node. And then the lymphedema has the positive stemmer sign, and the skin changes, including fibrosis, papillomatosis, hyperkeratosis, and it's progressive tissue enlargement. Next slide, please. So both the treatment of these involves compression and diet and lymphedema therapy. So that can be, lymphedema therapy can be lymphatic massage, manual lymph drainage, there's breathing exercises, and then there's intermittent compression pumps. And they all help to overcome the relative inefficiency of the lymph. Next slide, please. Then there's, so the lipedema can be also treated with reduction surgery. It's actually very effective. It's one of the more effective things we have for lipedema. And so it can improve the pain, swelling, and decrease the need for compression. Next slide. These are just a couple before and afters. This is kind of lipedema before and after. Next slide. Before and after lipedema reduction surgery. One more. Here's the lobule is gone. And next slide, please. And through the colony over the thighs is gone. And next slide. And one more. Yeah, and this is just, it affects the arms, and that's in the arms. Next slide, please. So the bulk tissue in both lipedema and lymphedema do affect the knee flexion, and then this is just a reminder that you need certain knee flexion degrees to do certain activities. So obviously getting in and out of the car, you need 135 degrees of knee flexion, and keep going. So I did the study. I'm actually just submitted this for a publication showing on this lipedema reduction surgery that it improves the knee flexion by 9 degrees and 8 degrees in the legs, and they improved their gait, and significantly, and then with 79% normalizing their gait after the reduction surgery. Next slide, please. So this is just how I probably should have put this slide ahead of it, but this is basically a lipedema leg. And so with this long arm goniometer, commonly used in orthopedics to measure knee flexion. And then here's where their goniometer lines up, and that's less than 90 degrees. So she's going to be limited in even going up and down stairs. And this is where the green arrow would be where it should be, and then that would not have no limits on her functional abilities. And so, next slide, please. So I also looked on this PROMIS, which is stands for Patient-Reported Outcome Information System, which was developed by the NIH and the RAND Medical Outcomes SF-36. And next slide, please. And these are studied in many diseases, and you can see all the patients started well below the normal population average, and then they either improved to close to or actually above the population average, like role functioning. These are all components of physical health. Everything from social functioning to energy, fatigue, and pain, etc. And so they all had significant improvements in these measures. Next slide, please. This is just a graphic representation of the same data. Next slide, please. So this is these are looking at these individual PROMIS outcome measures, and so they had a 15% increase in the ability to walk, and that's highly significant. And that actually has been correlated with timed gait test and stuff like that. So this ability to walk at a normal speed, go up and down stairs, get up from the floor, or sit to stand. These measures are correlated with rates of disability, falls, eventually even mortality. So they're very powerful. These are linked to very powerful outcomes, and they've been validated. I mean, this has been validated in many studies, and we're going to go to the next slide. And we see here that they've studied these same measurements of PROMIS and the range of motion, and these things in total knee replacements. As you can see, this is basically just doing the outside of what a total knee. So using these validated outcomes, this reduction surgery has improves mobility, quality of life, activities of daily living, similar to a total knee replacement. And in fact, I can just say they're comparable because they're actually higher, but I don't know if I can validly say they're 2 to 3 times higher. Just in these outcomes, they're 2 to 3 times higher. So I mean, that gives you obviously we don't think twice about doing a knee replacement, but for someone who has arthritis, but obviously this shows you can get similar kind of outcomes and benefits with the lipedema reduction surgery in someone with lipedema. Next slide. This is the end. Yep, perfect. Thank you guys so much for letting me share.